Hi, ladies. It's Barbara, and I am your menopause drama mama. If you're new to my channel, welcome. Um, Today, I want to talk about if you ever think that you might be deficient in vitamin D. And vitamin D, of course, you should take with, it's D3K2. So, anyway, here are just some of the your most common signs and symptoms that you could be deficient in vitamin D, but also realize that I never am giving medical advice either. So these are just things that I know I've gone through personally, and I've done research on stuff since going through menopause, and now I'm just sharing it with you. But here are the some of those signs and symptoms that you could be deficient in vitamin D. And I do wish that doctors would do a monthly blood panel, like with your lipid panel, to see what perhaps vitamins or supplements that you could be deficient in. It would just make so much more sense. But anyway, number one is if you have this constant fatigue and low energy going on. If you ever notice in the summertime and it is sunny out, everybody is, you're outside, people are enjoying themselves, they're doing things, everyone's active and happy, their moods are just so much better. Well, that's that good old sun, which is giving you vitamin D. So, if you're deficient in it, you could very well be just lacking that one vitamin, and that is D, because we're not getting the sun much during the winter. Um, Another one is being depressed, so a very low mood. Um, I know I had been diagnosed with that many years back. That I is definitely a seasonal person who was depressed during the winter months because I never got outside. I disliked the cold. So, and during the winter months in the Midwest, you rarely get the sun. It's always gloomy outside. So, I was seasonally depressed, and my doctor had definitely, at that time, told me that I needed to be on extra vitamin D. Um, but my doctor, so during the summer months, he said 5,000 IUs. And during the winter months, I needed 10,000 IUs just because I didn't get outside much and wasn't in the sun and wasn't absorbing much. And probably then also my diet was not that well. So, anyway, also, if you get sick very often, colds, flus, infections, that's a, big sign that you could be vitamin D deficient. Another one is brain fog, trouble concentrating, very poor sleep quality. Another one that's a big one is your muscle, joints, and bones. So, like your muscle weakness, you can have muscle cramps or aches, especially in your legs, your calves, joint pain and stiffness, bone pain. Now, I'm obviously that could be, osteoporosis or osteopenia if it's in your bones. So that's why you definitely would need to seek medical advice from a physician to have those checked and make sure that it's not just a vitamin D deficiency, but being deficient leads to those things. So you want to catch it early as possible. Um, Also, stress fractures. If you are deficient in vitamin D, you can get stress fractures, and that's not good. And that can help extremely quickly when you can get one. Because I had a friend who happened to step on one of her dog's toys, and she actually broke her foot. So just your bones get very weak, and so that is most likely a big vitamin D deficiency. But of course, my friend was also had gone through chemotherapy. So that chemo draws away from your bones. So the density is very low. Also, if you have, you know, teeth sensitivity, increased cavities, and gum inflammation. Now, I am going to be doing another video, maybe probably two actually, on oral health care because I found some really, really good tips for you. So stay tuned because that's going to be coming up very soon in my videos for you is for your teeth and, the gums. But anyway, vitamin deficiency, you know, can happen with your teeth and your gums. Another one is skin and hair. When you are vitamin D deficient, you start with hair thinning, and a lot of shedding, and you can have very dry and dull skull. And also, you have very slow wound healing when you are vitamin D deficient. Also, hormone weight and metabolism difficulties. So, you are having a really difficult time losing weight. You have insulin resistance tendencies when you are vitamin D deficient, and worsening menopause symptoms, with aches and pains and your mood shifting. Also, vitamin D deficiency affects the nervous system. And so that can be anyway, ranging from anxiety, irritability, mood swings, low motivation, increased pain sensitivity, and some of literally the worst and most, I would say they would be like the worst things that can happen if you are vitamin D deficient is increased or cardiovascular risk. And you can have like, in rare cases, it would be bone deformities. So, and that's like extremely rare and advanced cases of vitamin D deficiency. But overall, vitamin D becomes more critical for our bone density, our immune resilience, our muscle strength and balance, mood stability, and also brain health. So, if you have ever wondered if you are vitamin D deficient and you have any of these signs or symptoms, then I encourage you to, one, see your physician at least for a yearly physical, menopause doctor. So that's always in the link below, Menopause Society, to make sure and be tested to see if you could be vitamin D deficient. I will show what the percentages of the population that is vitamin D deficient because I don't remember what it is offhand. I know it was pretty high, but I will show what it is here, what the percentages of our population. And if you do want to supplement with a vitamin D, now for me, I have used the Dr. Berg brand D3K2, and that would be this one. And this would be my 10,000 IUs that I would take. And I also would have my liposomal D3K2, and this one is, I believe it's 5,000 IUs. I can't see it on here though. But this is the other D3K2 that I take. I was pretty sure this was 5,000, but I don't know. It is infused with an organic coconut oil for better absorption, though. So, anyway, that's it. If you're ever wondering if you are vitamin D3 deficient and you want to take that K2 so that the the vitamin D doesn't go into your blood, you do not want that. You want it into the bone system. Make sure you always take it with the two, D3 and K2 together. Okay, ladies, that's it. I love you. Sending positive vibes your way. As always, sending hugs your way. And I hope you're having a fantastic day wherever you are in this world. I hope you enjoyed this video. If you did, please click the like button If you haven't subscribed to my channel, I would greatly appreciate it if you did. And hit that bell down below if you want to be notified of more videos when I make them. Okay, love you ladies. Take care. Mwah. Have a great day. Bye-bye.